Hello everyone, I am Tanvi. I'm here to present some important topic about autism. Let's get into the topic. What is autism? Autism, also called autism spectrum disorder, that affects communication, behavior, and social interactions. The characteristics of autism spectrum disorder can vary widely among individuals, making it a spectrum disorder. People with autism have trouble with the communication. They have trouble understanding what other people think and feel. This makes it hard for them to express themselves, either with the words or through gestures. Gestures are nothing but a movement of body, especially hands, arms, head, or other face, that shows or emphasizes an idea of feeling, facial expressions, and touch. Autism, defined as a neurological and developmental disorder that affects how people interact with others, their communication, learning, and behavior. Although autism can be diagnosed at any age, it is described as a developmental disorder because symptoms generally appear in the first 2 years of life. Why it is called as spectral disorder? Autistic clinical manifestations encompass several key areas. Pragmatic language, which involves challenges with social communication, including body language and interpreting conversational norms. Social awareness refers to difficulties in picking up on social cues and maintaining relationships. The monotropic mindset manifests as intent focus on specific interest, making it hard to switch tasks. Information processing may be slower, affecting adaptation to new information or environments. Sensory processing includes hypersensitive or hyposensitive to stimuli. Repetitive behaviors or stimming are common response to emotions. Neuromotor differences range from coordination issues to challenges in fine motor skills. Understanding these accepts help in providing appropriate support and fostering inclusive environments or autistic individuals. Since they show spectral type of manifestations and different combinations of these spectrum vary from person to person. Hence, autism is known as autism spectrum disorder. In this slide, we are going to see the etiology, which includes genetic factors, environmental factors, older parents, sibling with autism, very low birth weight, gastrointestinal problems in child, heavy metal toxicity, and exposure to the chemical pollutants. Pathophysiology, autoimmunity, placental dysfunction, maternal infection, stress, increase in the reactive oxygen species, susceptibility genes that causes prematurity in fetus or infant, which leads to the increase in the mast cell activation, which can also be triggered by brain autoantibodies, neonatal stress, increase in the CRH, corticotropin releasing hormone. It is a primary stress response organizer which balances the stress levels of the person. NT, it is a neurotensin, infections, environmental toxins, neuropeptides, allergens, increase in the IgE antibodies, which activates the mediator such as extracellular mtDNA, tumor necrosis factor, interleukin 6, which leads to the disruption of gut and blood brain barrier. The relation between the gut and blood brain barrier is that the gut bacteria maintains vagal nerve function, which is an important pathway which is connected with the blood cerebrospinal fluid barrier function. Hence, slight changes in the gut might lead to the change in the blood brain barrier and vice versa. Since the disruption of blood brain barrier and the gut occurs, the inflammation of brain is commonly seen in the autistic patients. Hence, the brain inflammation leads to autism. Clinical manifestations include speech development, prefer to play alone, sleep problems, rejecting the cuddles, depression, repeating certain behaviors or having unusual behaviors such as repeating words or phrases, not responding, connection problems, learning disability, avoids or does not keep any eye contact, epilepsy and seizures, fails to respond his or her name, unusually sensitive to sound. Social communication interactions behavior may include making little or inconsistent eye contact, appearing not to look at or listen to people who are talking, having difficulties with back and forth of conversations, often talking at length about a favorite subject without noticing that others are not interested or without giving a chance to others to respond, displaying facial expressions, movements, and gestures that do not match what is being said, having an unusual tone of voice that may sound sing song or flat or robot like, difficulty sharing in imaginative play or in making the friends. And other clinical manifestations may include restrictive and repetitive behaviors like repeating certain behaviors or having unusual behaviors such as repeating words or phrases over again and again, having a lasting intense interest in specific topics such as numbers, details, or facts, showing overly focused interest such as with moving objects or parts of objects, becoming upset by slight changes in a routine, and having difficulty with transitions, being more sensitive or less sensitive than other people to sensory input such as light, sound, clothing, or temperature. People on the autism spectrum also may have many strengths, including being able to learn things in detail and they can remember information for longer period of time, being strong, visualize and auditory learners. They are excellent in maths, science, music as well as art. Diagnosis. There are different diagnostic procedures at different age group of individuals. Diagnosis in young children is often a two-stage process. In stage 1, there is a general developmental screening during well child checkups. The American Academy of Pediatrics recommends that all children receive screening for developmental delays at the 9th, 18th, 24th, and 30th month well child visits, with specific autism screenings at their 18th and 24th month well child visits. A child may receive additional screening if they have a higher likelihood of autism spectrum disorder or developmental problems. In stage 2, there is a additional diagnostic evaluation. The diagnostic evaluation is likely to include like medical and neurological examinations, assessment of the child's cognitive abilities, assessment of child's language abilities, observation of child's behavior, and in-depth conversation with child's caregivers about the child's behavior and development. Assessment of age-appropriate skills needed to complete daily activities independently, such as eating, dressing, and toileting, because autism spectrum disorder is a complex disorder that sometimes occurs with other illness or learning disorders. The comprehensive evaluation diagnosis in older children and adolescents is different as compared to the diagnosis in the young children. Some children may have problems like understanding the tone of voice, facial expressions, or body language. Older children and adolescents may have trouble understanding figures of speech, humor, or sarcasm. They may also have trouble forming friendships with peers. Diagnosis in adults. The experts will ask about social interactions and communication challenges, sensory issues, repetitive behaviors, and restricted interests. What are the treatment options are available for autism spectrum disorder? Medication. A healthcare provider may prescribe medication to treat specific symptoms. With medication, a person with autism spectrum disorder may have fewer problems like irritability, aggression, repetitive behaviors, hyperactivity, attention problems, anxiety, and depression. Behavioral, physiological, and educational interventions. These programs may help people with autism spectrum disorder learning social, communication, and language skills, reduce behaviors that interfere with daily functioning, increase or build up more strength, learning, life skills, or living independently. Thank you for your time. I hope you found this presentation informative and useful.